1. A nurse is caring for a patient diagnosed with malaria who has a high-grade fever, chills, and diaphoresis. Which nursing intervention should be prioritized to reduce the risk of complications? Answer. Administer prescribed antipyretics and initiate cooling measures to manage the fever. Rationale. Controlling fever is critical in malaria to prevent complications such as seizures and dehydration, especially during the acute phase of the disease. 2. A patient with malaria is receiving 4-quinine. The nurse notices the patient is complaining of ringing in the ears and blurred vision. What is the nurse's best action? Answer. Immediately stop the infusion and notify the healthcare provider. Rationale. Tinnitus and visual disturbances are signs of quinine toxicity and warrant immediate cessation of the drug and medical evaluation. 3. During an outbreak of malaria, which patient should the nurse assess first? 1. A patient with mild chills. 2. A patient who is vomiting. 3. A patient with confusion and a temperature of 104 degrees Fahrenheit. Answer. Assess the patient with confusion and a temperature of 104 degrees Fahrenheit first. Rationale. Altered mental status and high fever may indicate cerebral malaria, a life-threatening complication requiring immediate intervention. 4. A nurse is delegating care to a nursing assistant for a patient with malaria. Which task is appropriate to delegate? 1. Administering for antimalarial medication. 2. Monitoring for signs of anemia. 3. Assisting the patient with bathing. Answer. Assisting the patient with bathing. Rationale. Bathing is a non-invasive task within the scope of practice of a nursing assistant, while the other tasks require nursing judgment. 5. A nurse is reviewing discharge instructions with a patient recovering from malaria. What teaching should be emphasized to prevent reinfection? Answer. Use insect repellent, wear protective clothing, and sleep under insecticide-treated bed nets. Rationale. Malaria is transmitted by mosquito bites, and prevention measures focus on avoiding mosquito exposure, especially in endemic areas. 6. A patient receiving chloroquine for malaria reports visual disturbances. What should the nurse do next? Answer. Hold the medication and notify the healthcare provider. Rationale. Chloroquine can cause retinal toxicity, and visual changes may indicate a serious adverse effect requiring evaluation. 7. A nurse is caring for a pregnant woman diagnosed with malaria. What is the most important consideration in her treatment plan? Answer. Administer antimalarial drugs that are safe in pregnancy as prescribed. Rationale. Some antimalarial drugs are teratogenic. Therefore, treatment in pregnancy must be tailored to avoid fetal harm while effectively managing the disease. 8. A patient with malaria is being treated with artesunate. What lab value should the nurse monitor closely to assess for complications? Answer. Hemoglobin levels. Rationale. Artesunate can cause hemolytic anemia. Monitoring hemoglobin levels helps identify this complication early. 9. Which infection control measure is most appropriate for a patient with malaria in a non-endemic hospital setting? Answer. Use standard precautions. Rationale. Malaria is not transmitted from person to person through casual contact. Standard precautions are sufficient unless blood exposure is involved. 10. A nurse is planning care for a patient with malaria who is also malnourished. What is a priority nursing diagnosis? Answer. Imbalanced nutrition, less than body requirements related to infection and poor intake. Rationale. Malaria increases metabolic demands, and poor nutrition can worsen outcomes. Addressing nutritional deficits is essential for recovery. 11. A community health nurse is teaching about malaria prevention in an endemic area. What is the most effective community-based strategy? Answer. Promoting the use of insecticide-treated bed nets. Rationale. Bed nets treated with insecticide are highly effective in reducing mosquito bites and malaria transmission in endemic areas. 12. A nurse is caring for a child with malaria who is irritable and has a rapid respiratory rate. What should the nurse suspect? Answer. Metabolic acidosis. Rationale. Malaria can lead to metabolic acidosis in children due to impaired tissue perfusion and lactic acid buildup, requiring prompt recognition. 13. A patient with severe malaria develops jaundice and dark-colored urine. What is the likely complication? Answer: hemolysis and liver dysfunction. Rationale: hemolysis and liver involvement are common in severe malaria, leading to jaundice and dark urine due to increased bilirubin. 14. A patient recently diagnosed with malaria expresses fear about transmitting the illness to family members. What should the nurse explain? Answer: malaria is not contagious from person to person under normal circumstances. Rationale: malaria is transmitted only through the bite of an infected mosquito, not through casual contact, which helps relieve patient anxiety. 15. A nurse observes that a patient with malaria is disoriented and having seizures. What immediate action should be taken? Answer: ensure airway patency and call the rapid response team. Rationale: seizures and altered mental status may indicate cerebral malaria, which is a medical emergency requiring immediate intervention and airway management. 16. A nurse is preparing a traveler for a trip to a malaria-endemic region. What should the nurse emphasize regarding prophylaxis? Answer: begin taking antimalarial prophylaxis before travel and continue after returning. Rationale: prophylactic antimalarial medications must be started before exposure and continued after return to ensure full protection against infection. 17. A nurse is caring for a patient with falciparum malaria who is hypotensive. What is the likely cause of a hypotension? Answer: severe parasagmia leading to hypovolemia and septic shock. Rationale: falciparum malaria can cause systemic inflammation, capillary leak, and shock, necessitating fluid resuscitation and monitoring for sepsis. 18. A patient recovering from malaria reports fatigue and pallor. What should the nurse assess next? Answer: check recent hemoglobin and hematocrit levels. Rationale: anemia is a common post-infectious complication of malaria due to hemolysis. Monitoring lab values helps guide supportive treatment. 19. A nurse is supervising a student nurse caring for a malaria patient. Which action requires intervention? Answer: the student places the patient on airborne precautions. Rationale: airborne precautions are not necessary for malaria, as it is not transmitted through the air. Standard precautions are appropriate. 20. A nurse in an emergency department receives 4 patients with malaria symptoms. Which one should be seen first? 1. A child with a mild fever. 2. A pregnant woman with chills. 3. An adult with a heart rate of 130 BPM and confusion. 4. A traveler with complaints of joint pain. Answer: the adult with a heart rate of 130 BPM and confusion should be seen first. Rationale: tachycardia and confusion indicate possible cerebral involvement or shock, making this patient the highest priority for immediate assessment. 21. A nurse is evaluating the effectiveness of treatment in a patient with malaria. Which clinical finding would indicate improvement? Answer: the patient reports reduced fever, improved appetite, and increased energy levels. Rationale: resolution of fever, return of appetite, and improved energy are signs that the antimalarial treatment is effective. 22. A nurse is preparing to administer 4-artesunate to a pediatric patient with malaria. What safety check must be performed before administration? Answer: verify the patient's weight and calculate the correct dose based on weight. Rationale: pediatric antimalarial dosing is weight-based. Incorrect dosing can lead to undertreatment or toxicity. 23. A nurse is caring for a patient diagnosed with malaria who begins to have signs of hypoglycemia. What is the most appropriate nursing action? Answer: check the patient's blood glucose and administer glucose as prescribed. Rationale: quinine and severe malaria can induce hypoglycemia, especially in children and pregnant women. Immediate treatment prevents complications. 24. A nurse is caring for a patient who is scheduled to receive primaquine. Which assessment finding should prompt the nurse to withhold the medication and notify the provider? Answer: A history of glucose 6-phosphate dehydrogenase G6PD deficiency. Rationale. Primaquine can cause hemolysis in patients with G6PD deficiency and should be avoided in these individuals. 25. A nurse is conducting a home visit for a child recovering from malaria. What instruction is most important for the caregiver to follow? Answer. Ensure the child completes the full course of antimalarial medications. Rationale. Completing the full course of treatment prevents relapse and resistance development. 26. A patient admitted with malaria complains of shortness of breath and has crackles on auscultation. What complication should the nurse suspect? Answer. Pulmonary edema. Rationale. Severe malaria can cause fluid overload and capillary leak syndrome, leading to pulmonary edema, a potentially life-threatening condition. 27. A nurse is reviewing a patient's chart and notes recent travel to an area with drug-resistant malaria. What should the nurse expect regarding the treatment plan? Answer. Use of artemisinin-based combination therapy, ACT, as first-line treatment. Rationale. ACTs are effective against drug-resistant strains of malaria and are the current standard in resistant areas. 28. A nurse is providing care for a patient with malaria and newly diagnosed renal impairment. What should be a priority nursing intervention? Answer. Monitor urine output and renal function tests closely. Rationale. Malaria-related renal impairment can worsen rapidly. Early recognition through lab and output monitoring is essential. 29. A nurse is educating a group of nursing students about the pathophysiology of malaria. What should be included regarding the cause of cyclic fevers? Answer. The release of merozoites during red blood cell rupture causes periodic fever spikes. Rationale. Cyclical fevers in malaria correspond to the erythrocytic cycle of the parasite, particularly when RBCs burst. 30. A nurse is providing discharge teaching to a patient returning to a malaria-endemic country. What should the nurse emphasize regarding travel health? Answer. Start chemoprophylaxis before travel, during stay, and after leaving the area. Rationale. Effective prophylaxis requires strict adherence to timing before, during, and after exposure to endemic zones. 31. A patient with severe malaria is noted to have bleeding gums and petechiae. What is the nurse's next appropriate action? Answer. Notify the provider and assess platelet count. Rationale. Bleeding manifestations may indicate thrombocytopenia or DIC, both complications of severe malaria requiring urgent evaluation. 32. A nurse is supervising care provided by an LPN for a patient with malaria. Which task should not be assigned to the LPN? Answer. Developing the care plan and making nursing diagnoses. Rationale. Developing nursing diagnoses and care planning is outside the LPN's scope of practice and should be performed by the RN. 33. A nurse is planning care for a patient hospitalized with malaria who reports frequent night sweats. Which intervention should be included? Answer. Provide dry linens and change clothing as needed to maintain comfort. Rationale. Comfort care, including dry bedding and clothing, is essential to manage symptoms and promote rest. 34. A nurse is caring for a traveler diagnosed with malaria who asks why symptoms appeared weeks after returning home. How should the nurse respond? Answer. Some malaria parasites can remain dormant in the liver and cause symptoms later. Rationale P. Vivax and P. ovale can form dormant liver stages, hypnozoites, that cause delayed onset of symptoms. 35. A nurse is monitoring a child with malaria who is irritable and has sunken eyes and dry mucous membranes. What is the nurse's priority intervention? Answer. Begin fluid resuscitation as prescribed. Rationale. Dehydration in pediatric malaria can lead to hypovolemic shock. Prompt fluid replacement is life-saving. 36. A patient newly diagnosed with malaria asks why multiple drugs are prescribed. What is the best explanation by the nurse? Answer. Combination therapy helps reduce resistance and improve treatment effectiveness. Rationale. Using multiple drugs with different mechanisms prevents resistance and increases treatment success. 37. A nurse is providing education to a family whose child was treated for malaria. What should the nurse include to prevent recurrence? Answer: ensure follow-up to assess for relapse and complete radical cure if necessary. Rationale: some malaria types require additional treatment to clear dormant liver forms. Follow-up ensures complete resolution. 38. A nurse is assisting with the development of a public health initiative in a malaria endemic region. Which strategy should be prioritized? Answer: community-wide distribution of insecticide-treated bed nets. Rationale: mass distribution of bed nets significantly reduces mosquito exposure and is a cornerstone of malaria control efforts. 39. A nurse is assessing a febrile patient who returned from Africa 10 days ago. What is the most appropriate nursing action? Answer: notify the provider and initiate malaria testing. Rationale: recent travel to an endemic area with fever should raise suspicion for malaria, and early testing is critical. 40. A patient with severe malaria begins to exhibit irregular heart rhythms. What is the nurse's immediate action? Answer: stop the medication if it's associated with cardiotoxicity and notify the provider. Rationale: some antimalarial drugs, like quinidine, can cause cardiotoxic effects. ECG monitoring and immediate drug cessation are required. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!